The start to this holiday season so different for so many. Countless families spending Thanksgiving apart, but they are the lucky ones. At dinner tables across the country, more than 260,000 empty seats, while more than 90,000 Americans spent Thanksgiving in the hospital battling the virus. More than 4 million new cases this November, twice what it was in October, and the month is not over. Despite dire warnings advising against Thanksgiving gatherings, we also saw record-breaking travel. And today, we expect to break another record as millions of Americans are making their way home. This is just a snapshot of some of the nation's busiest airports this morning. But it is not just those lines at the airport that are causing fear. It is the images of these shocking lines across the country. Americans lined up for food. With a vaccine not widely available until next year, businesses remain shuttered, and more than 20 million people are claiming unemployment benefits. Dr. Anthony Fauci is standing by, but first, we wanted to take a closer look at this critical moment and those struggling in the long shadow of the pandemic.
We still have months of this battle ahead of us.
President-elect Joe Biden warning that the fight against COVID is far from over.
We have to try to slow the growth of this virus. We owe it to the doctors and the nurses and other frontline workers.
It's about 2:30 in the morning. I just got home from work.
Last March, when this all began, we talked to emergency room doctor Erin Beaumont.
All of a sudden, we just got overwhelmed, ambulance after ambulance, with hypoxic patients, people in respiratory distress.
Dr. Beaumont, who works in the Boston area, has grown tragically used to the toll of this pandemic, but is bracing for a post-holiday crush of patients.
One of the constants that we've had throughout this pandemic since the beginning is the component of stress and fear that the healthcare workers and the frontline providers are experiencing every single day. We're tired of this. We're exhausted.
But the pandemic strains extend far beyond the halls of hospitals, months of economic hardship marking the start of the holiday season. That need evident across the country, cars backed up for miles, people standing in line for hours, even in the rain, just to get food.
You know, I'm a single parent, just trying to provide for my family right now. I'm not working.
Hunger in this country at a new high. 1 out of every 8 Americans say they sometimes don't have enough food to eat. For households with children, it's 1 in 6.
I've never witnessed the system being more strained than it is right now.
Edna Pagnon turned to the Arlington Food Assistance Center after health concerns forced her to leave her job as a grocery store cashier.
We get food once a week, yes. And it's a big help for us. We already got the turkey.
So you'll have a Thanksgiving?
Oh, yes.
Because of this place?
Yes, because of this one, yeah.
Just miles from my own home in Virginia, long lines here where they've seen a 45% increase in the families coming for food. Executive Director Charlie Meng worries it could get worse.
It can get very difficult at times watching these lines getting longer and longer.
What do you expect in the coming months?
When county support, federal support drops off, our families will come to us in even greater numbers. And that's my biggest fear. And, we have to serve all of those people. We are committed to serving everybody who comes to our doors.
It's just one of the many monumental hurdles facing the president-elect as he inherits the responsibility of a nation reeling from the pandemic.
Hang on. Don't let yourself surrender to the fatigue, which I understand. It is real fatigue. I know we can and we will beat this virus. And joining me now live is the director of the National Institute of Allergy and Infectious Diseases, Dr. Anthony Fauci. Dr. Fauci, welcome back to This Week. Today could be the busiest travel day in the country since the start of the pandemic, even though you and other public health leaders have made appeal after appeal for people to stay put and distance as much as possible. When you watch these scenes, what do you think, and what else can you possibly say to them?
Well, I mean, the travel that has been done has been done. Right now, as people go back, we want to urge them, if they've been in situations outside of the family setting in which they really don't know the level of exposure, to be really careful when you either return from the place that you went or other people come back into your house, that you've really got to understand the importance of trying to prevent further spread and further surge. That may be when you go back to where you came from, if it's possible to quarantine yourself for a period of time, or even get tested to make sure that you're not bringing infection back to another place, be it another home or another family. Having said that, we have to be careful now because there almost certainly is going to be an uptick because of what has happened with the travel. We understand the importance of families getting together, and it's just something that we have to deal with, that we likely will have an increase in cases as we get into the colder weeks of the winter and as we approach the Christmas season. Please don't forget the standard public health measures that we talk about. The reason I say that, Martha, and almost plead with people, is that we do know that it does work. Countries that have mitigated have turned around the surge. States that have mitigated have had a turnaround of the inflection of the curve. So it does work. And as we've just heard, help is on the way. Vaccines are really right on the horizon. We'll be having vaccines available for the higher priority people towards the middle and end of December and as we get into January and February. So everyone is totally empathetic about the fatigue that everyone is feeling. But if we can hang in there a bit longer and do the fundamental things, wearing of masks uniformly, avoiding crowds in congregate settings, keeping physical distance, washing your hands, they seem simple in the enormity of the problem that we're facing, but they do make a difference. So
Dr.
as much as we pleaded before the beginning,
Dr. Fauci, you have said that again and again and again. We saw all those people traveling. So you know what's coming, and with Christmas just around the corner, do you think we'll be under the same restrictions that you recommended on Thanksgiving going into Christmas?
You know, Martha, I can't see how we're not going to have the same thing, because when you have the kind of inflection that we have, it doesn't all of a sudden turn around like that. So clearly in the next few weeks, we're going to have the same sort of thing. And perhaps even 2 or 3 weeks down the line, Martha, we may see a surge upon a surge. You know, we don't want to frighten people, but that's just the reality. We said that these things would happen as we got into the cold weather and as we began traveling, and they've happened. It's going to happen again. So I cannot see all of a sudden a relaxation of the kinds of recommendations or restrictions, because we're getting into colder weather and in an even larger holiday season as people travel to come back and forth for Christmas. So I don't see a relaxation of the kind of recommendations and restrictions that we've made.
And Dr. Fauci, the Supreme Court on Wednesday struck down New York's COVID restrictions on religious gatherings in the state. How concerned are you about legal challenges to pandemic restrictions going forward?
Well, I mean, they happen, Martha. There's nothing I can do about it. I just keep saying that when people ask me for opinions of specific things, rather than make a comment on a specific things, I can just say it doesn't matter who you are, where you are, when you have congregate settings, particularly indoors when people are not wearing masks, that is a considerable risk for acquisition and spread of infection. No matter what the circumstance is, that is a risk.
And you've said there should be more regular testing available for asymptomatic people. How soon do you think before Americans could have inexpensive home tests, and why haven't they so far?
Well, I hope it's sooner rather than later, Martha. I mean, obviously we've done better in testing than we did early on in the beginning. But you're talking about different kinds and different motivations and different objectives of testing. If you're trying to find out if a person is infected, either for contact tracing or what have you, then you want a highly sensitive test that might take a day or two to get a result back. But when you're trying to find out what the extent of the community spread is, that is driven very clearly, at least in part, by asymptomatic spread. So we need to know the extent of the asymptomatic. The only way you know that is what you just asked for. And I would like to have seen it already, and I hope that we get it soon. Rapid, sensitive, specific home testing, even one that you might not even need a prescription for, so that people can have within their own power to know whether or not it isn't as highly sensitive as the other, but it is very helpful, particularly if you do it over and over again. I hope we get that soon.
And Dr. Fauci, New York City public schools shut down again earlier this month. I know your default position is that you'd like to see the schools open, but how do you make that happen? And how would you advise the incoming Biden administration on getting a sort of unified response?
Well, you know, Martha, that's a good question. We get asked it all the time. You know, we say it not being facetiously as a soundbite or anything, but, you know, close the bars and keep the schools open is what we really say. Obviously, you don't have one size fits all, but as I said in the past, and as you accurately quoted me, the default position should be to try as best as possible within reason to keep the children in school or to get them back to school. The best way to ensure the safety of the children in school is to get the community level of spread low. So if you mitigate the things that you know are causing spread in a very, very profound way, in a robust way, if you bring that down, you will then indirectly and ultimately protect the children in the school, because the community level is determined how things go across the board. So my feeling would be the same thing. If you look at the data, the spread among children and from children is not really very big at all, not like one would have suspected. So let's try to get the kids back, but let's try to mitigate the things that maintain and just push the kind of community spread that we're trying to avoid. And those are the things that you know well. The bars, the restaurants where you have capacity seating indoors without masks. Those are the things that drive the community spread, not the schools.
And Dr. Fauci, you talked about the vaccine and the availability of the vaccine. The government can't force everyone to take the vaccine. So what about schools, companies, employers? Can they mandate a vaccine like in other vaccines?
You know, any individual group can mandate vaccines in certain ways, Martha. It's not, I believe, going to come centrally. I don't want to get ahead of the game there, but I doubt that that would happen. For example, right now myself, I mean, I'm at the NIH Clinical Center. I'm a physician. I see patients. I have to get the influenza vaccine or I'm not going to be able to see patients. So individual units, be they hospitals or other organizations, can do that. It's within their right to say, if you want to work with us, you're going to have to get a vaccine. But that's not going to be, I believe, a centrally mandated process.
And Dr. Fauci, there are concerns about the anti-vaccination movement. An infectious disease specialist in Boston telling the Boston Globe the same energy that was placed into development and distribution of a coronavirus vaccine should have been placed in messaging and community engagement. Do you agree with that?
Oh, absolutely. We have to engage the community, Martha, because we do have a degree of anti-vax to begin with, but then there's skepticism about this vaccine. So we've got to be able to get out there, get community people who the community trusts to show two things. The process of the development of this vaccine has been one that has been scientifically sound. Safety has not been compromised. Scientific integrity has not been compromised. And the process of determining whether it works, whether it's safe and effective, has been independent by independent bodies and transparent. We've got to get the community, the broad community of the United States, to see that and appreciate that.
And how can we be sure there won't be prolonged side effects from this vaccine?
Well, you know, Martha, the one thing you've got to admit that in any intervention, there might be a side effect. The history of vaccinology that we know for decades and decades is that when you talk about prolonged side effects, that's very rare. And the side effects that occur that are beyond the immediate pain in the arm and the fever and things like that generally occur when you look at like 95% of the time between maybe 30 and 45 days, which is the exact reason why the FDA said that they would not want to issue an EUA or approve an EUA, an emergency use authorization, until 60 days after half of the people in a trial have gone from their last dose. So already the FDA has baked into the process a safety mechanism to make sure that you have historically overwhelming chance that you're not going to have a very late effect. Having said that, also, you don't just forget about it once the trial is over. You have 1 or 2 years of the trial follow-up in addition to post-trial follow-up. So that's something that is very, very high priority, is the immediate, intermediate, and long-term safety of these vaccines. It's not something that's being disregarded.
Okay, thanks so much for joining us this morning, Dr. Fauci. It's always great to see you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.